The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hello, everyone. This is Talk Politics. I'm Deborah Hutchison in the Rogers TV studio. Our guest this week, joining us via Zoom, is Durham Regional Chair John Henry. Welcome back to the show. Thanks for taking some time out of your incredibly busy schedule to spend some time with us. How are you?
Well, thank you for the question, and it's great to be back. We are busy. Since we declared the emergency back in March, the region is very much open for business. Everything that we do is an essential service. So on top of all the things that we need to do to support our residents, we're also dealing with COVID-19. So it's incredibly busy, but I'm really proud of the team and the staff here at the region and council and how we've all come together to deal with such a major problem, the largest problem we've had since World War II.
Yeah. Let's talk about concern over the increase in COVID numbers. As we are taping this on October the 8th, we've set a new provincial daily record, 797 new cases. According to the Ministry of Health website, in Durham, that equates to 22 new cases. How concerned are you with this second wave?
Well, I'm incredibly concerned. And this weekend, the long weekend, it's Thanksgiving. People tend to, prior to COVID-19, would come together as families to celebrate all the things that make Canada such an amazing place to live. And this year, it's going to be very different. We're very worried about groups of people coming together. We still need, because you can't see COVID-19 doesn't mean it doesn't exist. And the numbers are showing that. Don't gather in large groups, wear your mask when you're out in public, wash your hands. Don't take the entire family grocery shopping, practice social distancing. These are all really important things. So this weekend, hopefully our residents throughout Canada will gather via the same way we are, FaceTime, Zoom meetings, celebrate Thanksgiving together, but you're going to have to do it in a new way. And we're in this together. There isn't a community in the GTHA that hasn't got these challenges. And, I'm deeply concerned, along with the mayor of Toronto and the leadership around the GTHA. We talk every Monday about the challenges that are going on in the region, and not this Monday because it's a holiday, but and the challenges that we're all having. We're all in this together. And if we work together and continue as we did earlier in the start of COVID, our numbers in Durham were very good. We were down to a number of days in a row that were zeros. And now we're seeing numbers. I checked the stats for yesterday. We have 67 people in home isolation as of yesterday, but not including the numbers of today. Yesterday we had 3 people in hospitals. We had 1 person in the ICU, and we need to be diligent. If we do these simple things, while we may not be able to get together for Thanksgiving, if we do this and we practice all the right social distancing and wearing masks, maybe we can come together at Christmas as families. And hopefully our numbers will start to go back down again. People will become more conscious. You're just part of the team, and you just have to practice the things that we've done that have gotten us so far. And I'm really proud of the residents on our numbers in Durham and how we've been able to do. But this isn't over, and we need to continue to be diligent and work together so that maybe our next celebration will allow our families to come together.
As the experts tell us, our numbers are comparatively low compared to, a Toronto or, a Brampton or an Ottawa, but they can very quickly get out of hand.
Oh, Deborah, you are absolutely right. Our residents in Durham have done an amazing job working together. But it wasn't that long ago there was an event in a community center in Oshawa for a wedding where there was a number of people, and it only takes one event to put a number of people into the challenges we have related to COVID-19. And we need to work together. If you're not feeling well or you're feeling sick, stay at home. Don't go out. Here at the region, we've been very, very lucky. We've been able to continue to do everything we do, and almost seamlessly when you call into the region and you get somebody on at the service desk. For residents, they probably don't know that operator is working from home, that we've been able to move well over 1,400 people to work remotely to deal with the day-to-day issues that are going on, and so that we can still provide that seamless level of service. But the residents need to know that the people that work here at the region, we're practicing all the things that we're asking you to do. Social distancing, our buildings are closed, but we're still able to maintain the interactions that we need. We're doing more online. We're changing how we do business, and I'm really proud of the fact of how quickly, in under 2 weeks, we were able to get 1,400 people working from home. There's a lot to be said for the people in the background that you don't see, our IT staff, our legal staff, the folks that work in our wastewater treatment plants, our water pumping stations, and then the people that you see every day, police officers and paramedics and our regional workers that are out there, the people that work in our long-term care facilities. We manage we have 1,400 people, over 1,400 people work in our long-term care facilities that meets the needs of our seniors. And then all of the other people that are out there in the municipalities, the frontline service people, the firefighters, the healthcare workers, the public health nurses that are now working along with the school boards to try to make sure that we will do the best we can to protect our residents no matter what their age is.
Let's talk about, you mentioned public health care. Let's talk about the demands on Durham's public health workers and the overwhelming stress that they're under. How confident are you that we have enough workers to meet the demand of the public tracing, of the phone calls, of the testing?
So, each week we get more messaging from the province, and we're receiving more funds for different applications. So, I'm proud to say that we're able to put more public health nurses out working with the school boards. There was some funding that came in for that. In our long-term care facilities, one of the challenges that we had when our facilities were physically closed to the public and to families is we lost all of our volunteers, and our volunteer base within our long-term care facilities is huge. So during the pandemic, we were actually out having to hire people to come in and work in our long-term care facilities, the ones that we own. So we repositioned people within the organization and moved them out of the jobs where there might not have been any work, and give them options to work in our long-term care facilities. And then going forward, the additional costs related to PPE for all our services, whether it be our nurses or our paramedics, our staff in our long-term care facility, and police officers and firefighters. So there's all these moving pieces that we've been able to navigate. Here at the region, we activated, when we declared the emergency, we activated our office for emergency management here, and we have a conversation every week. We gather as a team. We do it virtually so that we can interact. We talk about the challenges. We talk about where we need to look for, for example, N95 masks, or if there's challenges that we're being very proactive. And that team brings all of that data that we collect each and every week, and then we analyze it as a group, and we go forward, and we've got our plans. So that group has worked relentlessly and tirelessly during this time, along with Dr. Kyle and his team. Dr. Kyle has done just amazing work, along with Dr. McTavish. In Durham region, it's not a council resolution about wearing a mask. It's a medical officer of health order that you're supposed to wear masks in public places. So we've done some amazing things. The team has done really great work. Our wastewater teams have gone into work. We've staggered start times so we don't have large groups of people going into our treatment plants. And then, of course, the staff that work in deal with childcare. The work that they've done has been simply amazing. And at one point, we were running 24/7, 7 day a week daycare for our most essential workers, and trying to navigate all of that. So it's been a really great partnership with all of the teams here at the region, our unionized staff, our management teams, and of course the residents that have continued to support all the great things that are going on and are helping us by doing the things that they need and following the direction of Dr. Kyle.
It was really learning on the fly through phase 1 of this pandemic. Now that we are in, obviously, phase 2, are we prepared? How much more prepared are we now than we were back in phase 1?
Well, we were very lucky. We have municipalities have emergency operations plans to deal with this, and we were very lucky that we had a plan that we could pull out that was based on SARS that we were able to update very quickly. But you're absolutely right. This entire issue it evolves every day. Numbers change. We have to be nimble and quick and be able to adapt and change how we do things here. And the big challenge for the region is the vastness of the region. We're 2,500 square kilometers. Clarington is bigger than the city of Toronto, so we've got 700,000 people living in a large area where we're doing our best to meet their needs, including keeping our waste transfer stations open. One of the things that we saw right away with COVID-19 is that when people were at home, they were finding ways to keep themselves busy, and so they were doing a lot of work around their houses or wherever they lived, and that increased the amount of waste that was going into our transfer stations. And we've managed to deal with all of that. We've managed to deal with transit and the great work that our transit operators do. Every day our buses are rolling where we're keeping residents, giving them the ability to get to and from work, get out to do their shopping, make their appointments. We've started our on-demand service that was started in the north, has been moved around through the region to help supply transportation in areas where there wasn't enough to keep buses running, but we've been able to manage that through our on-demand service. And our drivers and our transit workers come to work every day, making sure our buses are clean. You see them on the buses, they're moving people. And we still have to continue to do all of those things. And for the longest time, you were only allowed to board the buses through the back doors. We stopped collecting fares. We're now collecting fares again. But it's if you get onto a bus today, the driver's protected by a shield. People are asked to wear masks. And we're trying to keep things moving along and working together to make sure that people can get to where they need to be. And that is it's just another challenge. But the team here at the region in transit under Bill Holmes, who's the general manager, have done an amazing job. And I'm incredibly proud of the work that they've done. And I also want to thank you because, you help us get that message out. Talking about what our medical officer of health, Dr. Kyle, says about best practices to deal with COVID-19. And we don't often thank the media for helping us, but you've been a big help, and I want to thank you.
Well, you are welcome. And on that, I'm going to have to stop you there. We have to go to a quick break. More of our conversation with Durham Regional Chair John Henry after this. Don't go away.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello, our fantastic viewers. Season 7 of your loved LGBTQ show will be back on Rogers TV, second Tuesday of October. We're filming virtually, as you see, to keep everyone safe. And why am I holding the DVD of Hairspray, the musical? Because I'm a huge fan of the movie, but also because star Nikki Blonsky is going to be on the premiere episode, so do not miss it.
I'm Deborah Hutchison, host of Talk Politics. Each week we speak one-on-one with your elected officials at all levels of government about the issues that affect us all. Keep informed. That's Talk Politics each week right here on Rogers TV.
Hi, I'm Jennifer.
And I'm Allison.
Coming up on the next parenting show, we're talking about how to overcome boredom.
I'm bored. Play with me. Maybe it's a good thing.
Only on Rogers TV.
When we went to break, Chair Henry, we were talking about transit and the challenges throughout the pandemic. And as much as they have worked really diligently to keep the buses going. You know, they're also dealing with a dramatic drop in ridership as well.
You're absolutely right. You know, transit is subsidized by the taxpayers, and you know we kept the buses running, but of course we weren't collecting fares there for a while. So we have some operating costs and some some challenges financially. The region is looking at, you know, COVID, if forecasted out for the rest of the year, we're somewhere between 43 and 46 million dollars of operating costs that are going to be a challenge. We were very lucky. The province and the federal government recognized the challenges that municipalities were having. So far in the phase one recovery funding, we were able to get somewhere around $23 million from the federal government and the provincial government. And then here at the region, there was a lot of things that we could work on and navigate so that we could find those savings we needed to offset that additional 23 million. And you know, I'm really proud of the fact that the council and staff have worked really hard. And financially, we've got challenges, but we're in a really good place. And now the provinces and the federal government are talking about phase two funding, and we'll be putting our applications in. So COVID has been incredibly expensive for every municipality, for the entire country. It's been a challenge financially for us, but we have done a very good job at mediating the costs, and I'm really proud of that.
When we're talking about your budget going forward, you are holding a virtual town hall coming up on October 21st. That's a Wednesday between 6:30 and 7:30 p.m. and you want to hear from residents.
Oh, you know, absolutely. Going forward, our budget process, we're involving and changing very much how we do business, and we're reaching out through town halls on a number of issues to work with our residents to find better ways to deliver services. And this particular meeting is dedicated to our budget. Council is passed, gave staff direction that the budget needs to be in at or less than 2% for next year. And we're working hard to manage that. You know, we're very lucky. We have, you know, almost 6,000 employees in the organization. We have some very talented people that work for our residents, but we're also a unionized environment. We've got contractual obligations. We've got the increased costs related to, you know, the chemicals that you need for water treatment plants and how we do things within our community. And then we have the challenge, and I mentioned earlier, where we had to actually go out and hire additional people to work in long-term care. Mm. So we have a number of pressures on the budget this year. Council at our last meeting gave the guidelines at 2%, and I'm hoping that we can sharpen our pencil and do much better than that. But that will meet the needs of all the services that we are continuing to deliver through the region, manage our wastewater and our water, look after our roads, look after our employees, look after our long-term care facilities. So the budget process is very interesting. I'm looking forward to it, and I'm looking forward to hearing what the public has to say.
The budget is always a challenge, even in the best of times, but then you throw in the pandemic, which, you know, you admit is changing. The landscape changes every day. Last year's budget, you had just gotten it, you know, figured out, and then you had to throw it out the window when the pandemic hit and the emergency measures came in. How confident are you that you can keep the increase to 2% when there's so much unknown?
Well, you know, for us, and you're absolutely right, the unknown is out there, and we do our best to work with you know, all the other communities around the GTHA, the province, and the federal government. Our Economic Development Department did an amazing job when COVID first hit. They reached out to the boards of trade, the Chamber of Commerce, the BIAs, and started to get information from them so how we could support the business community. And we were very quickly able to get that information to the province so they understood the dilemmas that we're having. But it's been a challenge because on top of trying to deal with all the things that we're trying to support our local business community as well. So, you know, our Economic Development Department, Simon Gill and his team have done a great job with Invest Durham, down to businesses in our downtowns, the videos they put out, how they've worked with businesses to make sure that the the tools that they have are there, and in the services that we're able to provide. So, from delivering food to curbs to our agricultural community being able to do and set up online delivery services, they've done a really great job in making sure that not only the business community is being heard, but we've been able to help them, with their connectivity. We've got a number of talented people within our economic development department and a number of programs that are out there where we can take a business that might not have been online and help them get online so they can continue to do business in this new way of COVID-19.
Yet we still hear a lot about established businesses that were just hanging on, by their teeth throughout the first phase. Now the second wave is happening, and I think there's a lot of concern out there that a lot of these businesses, established and new, aren't going to be able to hold on.
Well, it's my hope in that if you or your family went out for dinner, every couple of weeks, that you would still do that, but you do curbside pickup. That you can support those restaurants and shops that you used to go to, but you have to do it online. And that leads to the other big challenge that we're having, and it's a national challenge. COVID-19 has really brought a light to the lack of a broadband strategy, a national strategy for our country. 155 years ago, our leaders decided they should build a railroad from coast to coast to coast. And, that railroad crossed rivers and valleys and mountains. And it was at its day, people said you couldn't do that. But in the end, we built this amazing railroad that connected our communities. The railroad of today is broadband infrastructure. And we need to do that. We need a national plan that connects our communities so that our young people can work from home and do their schoolwork, or if you're working from home, you'll be able to continue to do what you need to do. And right in some of our, we usually think when you have a lack of broadband, you think of the rural areas, and we have challenges in our rural areas, but we have challenges in the heart of our urban areas as well, where broadband, just the ability to move a lot of data very quickly, doesn't exist. So, we are out there, we're looking for different ways to work with the province and the federal government on a broadband strategy, but they really need to make this a national issue that goes from coast to coast so that we can continue to do business in this new way. And, I hope that after COVID-19 that we never see anything like this again, but we need to be prepared for something like this again. And having the proper infrastructure in place for broadband will make Canada a better prepared place in the event that we ever have another challenge again. And hopefully we don't. But we need to do a better job about being able to connect our residents.
In talking about the budget as well, I want to bring up the police budget. There was a lot of talk at the last council meeting about body-worn cameras, the pros, the cons, the cost. Should Durham Regional Police, every single one of them, be wearing a body-worn camera?
So at the last meeting, that was referred back to our budget process. So it will come back during the budget. Estimated costs for body-worn cameras is about an additional $3.5 million impact to our police budget every year going forward. Our police budget for 2020 was about $241 million, and it represents about 31% of our what we do with the budget dollars that we collect. But I want to at the same time, thank our police officers for the great work they do in the community, and each and every day they come to work, they deal with challenges, and policing has changed. Within this year's budget, I'm really proud to say that there is we are looking to hire some more mental health nurses to work in conjunction with the nurses that we have now, in a partnership between Lakeridge Health and Durham Regional Police. But to make sure that we have 24 hours, 7 day a week, 365 day of the year coverage for those who have mental health issues, and where we need to provide a different way to work with those people that are having challenges. And that's in the budget as well this year. We're changing the way we look at things. We're reallocating funds to meet the needs of our residents in a different way. And when you talk to police officers, there's a certain percentage of interactions where mental health is a big part of that. And bringing those services to support our police officers and our residents is key. And I'm really proud of the fact that the council is, and hopefully, and I support it, and we'll consider that and pass it in the budget, So that is part of the 2% we were talking about. The body worn cameras is relatively new, so it's been referred to after the last council meeting. It's been referred back to staff for the budget process. And there again, the police are just another part of that system of people that are out there in support for our residents. The great work that they do each and every day, but also the great work that our paramedics do too. Our paramedic outreach program is another project that we fund here at the region, where we've partnered a paramedic with a social worker, where we take services to those people living on the streets, our vulnerable residents, where we can provide a different level of care, different than we've done before. And we're having some great successes, but all that comes with hiring people and additional costs. So we're conscious of trying to make sure that we remain fiscally responsible, but at the same time, make sure that all the services that our residents deserve and are now asking for, we do our best to make that happen.
We were also talking a little while ago about long-term care, and there are some homes that the region runs. There was a lot of concern over lack of staff for proper care in the first phase, not necessarily your long-term care homes, but how confident are you that the long-term care homes that Durham runs are well-equipped and well-staffed this time around?
I'm incredibly confident of the work that our long-term care homes, the 4 that we have. So we have 2 in Oshawa, we have Fairview Lodge in Whitby, and of course we have Lakeview Manor in Beaverton, where we help to meet the needs of our senior community. And not everybody in a long-term care facility is also a senior. We have younger people in some of our homes as well, and whatever challenges that they're having in their lives. But I'm incredibly proud of the work they've done. And like I said, at the beginning of COVID, when we had lost that component of family members and volunteers that used to come in and work in our long-term care facilities and support our staff, we lost that. We actually had to go out in the most difficult times during COVID. We actually went out and hired the starting point. The first hire was somewhere around 230 people to
Chair
support
Henry,
the need.
I'm going to have to stop you there. They're telling me we're out of time. You're going to have to come back. Will you?
I'd love to come back and talk about all things that make Durham one of the greatest places in Canada to live. And there again, I want to thank you for taking the time to meet with me today. And really, this weekend, Thanksgiving, don't gather in large groups, wear your mask, practice social distancing. Don't take your entire family to the grocery store to buy the turkey. Just take one person, and together we are Durham strong, and we'll get through this together.
Okay. Our thanks to Chair Henry, and our thanks to you for joining us. Until next time, I'm Deborah Hutchison. Stay safe.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
The world's most famous Canadian, Grey Owl, just back from a triumphant British tour, is to be a reluctant guest at a gathering of First Nations.
Archie, you may not realize this, but right now you are the most famous Red Indian in the world. These are your people. You have to be there. Come on, Harry, let's go.
Sure, I'm sure. His name is Archie Bellini, and if he's a Red Indian, I'm the King of China.
It is an honor to meet the man called Grey Owl, who has brought much respect for our people.
Imposter, rascal, dreamer, and yet the Englishman who called himself Grey Owl awoke the whole world to our vanishing wilderness.
My brother says, men become what they dream. You have dreamed well.
I did it. I need it.
Here,